polio, stop polio, polio and then Dorothy and Pebio. Fight polio and polio, polio and then Dorothy and Pebio.
For decades, a silent enemy has found its way into our homes and playgrounds. A virus so small, yet so deadly, crippling children, tearing dreams apart, and burdening families for generations. This is the story of Isaac Kwaku Wadi, a man who has lived with the scars of polio for over 40 years. A survivor, a fighter, and now a voice for change.
I grew to see that I was not able to walk like how other children were walking. I was not playing like other people were playing. So it was when I grew along the line that I knew that I was a polio victim or survivor. In my childhood, I was crawling on the ground, and my parents had to make arrangements for me from a facility to acquire a wheelchair for me to use. So it was forth and back until we finally found out that it was polio. And it wasn't easy growing up, and you can bear with me that when as a student, a school kid, you go to school and your mates are playing, your fellows are playing, some will help you, but it's a school. Some also mock you or make fun of you. And when I grew up, or growing up, sir, the social environment, the accessibility, the stigma, and all the physical factors and the social factors that compound to make it a very serious and difficult situation to be a person with polio.
Paralysis, pain, stigma, a lifetime of dependency. This is what one mixed vaccine dose can cause. According to the World Health Organization, poliomyelitis is a highly infectious virus that invades the nervous system and causes irreversible paralysis, especially in children under 5. It says 1 in 200 polio infections lead to paralysis, while 5 to 10% of those paralyzed die when their breathing muscles are affected. There is no cure for polio, but it is preventable with just a few drops of vaccine.
In the disability community, a lot of things amount to a person being disabled. Car accident, by birth, these are situations you cannot control. So why not control what you have control over? You understand? That is why since 2015, I have been advocating for polio vaccination, because in any case, accidents, you cannot have total control of it. Being born as a person with physical disability, you cannot have total control over it. But for polio, at least, when they say that we should vaccinate the children, because I want to share with you that my parents were not educated, and in the place that I was born, the knowledge of polio vaccination was not, the awareness of the polio vaccination was not there. You understand? So now that that's awareness, I want to advocate that parents immunize their children against polio. Growing up, I wasn't given any polio drops. So that is a fact that I didn't get any polio vaccination. Because when I grew up, like I said earlier, it was diagnosed that I am having a polio. That's the reason why I couldn't walk. So I implore parents to take vaccination very, very serious. Any moment that it is available and it is being announced, we should all join hands on deck to promote the vaccination.
Since 2015, Ghana has been a polio-free country, but the danger is not over. The virus exists in countries like Pakistan and Afghanistan, and in today's global village, it takes one case to trigger an outbreak. Dr. Nazir Tanko Mohammed is the Deputy Program Manager for the Expanded Program on Immunization at the Ghana Health Service.
In Ghana, we do not have it, but as we speak, Pakistan and Afghanistan still are reporting that type of wild polio viruses. And we are worried because we have a saying that a polio case anywhere is a polio case everywhere. Because yes, we are in Ghana, but if Pakistan, for instance, is still reporting that type, if Afghanistan is still reporting that type, then it's a concern, because at any particular point in time, somebody can carry the virus from those countries to other parts of the world, isn't it? And Now we are living in global village. In the morning, you are in the US, you are in UK, you are in Pakistan. The following morning, you are in Ghana. And if efforts are not put in place to ensure that we are all well protected, then whenever such viruses surface again in our environment, then we are all susceptible and we are likely then to go down with the disease. That's why we don't want to take our eyes off at all from the interventions, i.e. the vaccination that we are given, so that with high coverage levels, then the population will be protected against the polio viruses.
Ghana recently has 5 routine polio vaccination schedules. A child is expected to take polio vaccines at birth, 6 weeks, 10 weeks, at 14 weeks, and at 7 months, which was recently included to reach every child, especially in remote and gated communities, which has especially been a challenge. The EPI continues to work with the health workers and volunteers who go into the communities to target and capture children who are due for vaccination, making sure that no child is left behind.
We have teams that will visit these hard-to-reach areas, usually either on quarterly basis, sometimes on monthly basis, so that a medical team or health team will move from their station where they are working and go and stay in such communities and deliver the service over a period and then come back. So those are special arrangements that are usually made. Then also, from time to time, we'll provide support. Those areas, what they need is like extra support so that when they have the enough resources, the vaccination teams or the health team will be able to again conduct some extra mop-up vaccinations in those communities. Because we don't go there too often, it means that the tendency of you losing some of them, in other words, you not reaching some of them, is high. So you don't rely on only the routine delivery. From time to time, you organize yourself, go in that community. Like, it is a form of enhancing the vaccination exercise where you actively now go search for those that you are missing to vaccinate them, though it's not the routine visits that you are conducting.
Civil society organizations like the Hope for Future Generations, in collaboration with Gavi and the Global Health Advocacy Incubator, are pushing for stronger domestic financing to sustain immunization in Ghana as donor support is dwindling. The HFFG says Ghana must take ownership of vaccine funding and efforts to ensure that polio vaccines and many other vaccines will be in abundance without experiencing any shortage, even when donor support ends by 2030. Mrs. Cecilia Senu is the Executive Director of HFFG.
Immunization is very important because that protects the health of our children and the future generations. It is cheaper. In public health, if you immunize your children, you are sure of their safety and protection from preventable diseases that kill them before the age of 5 years. And the reason why Hope for Future Generations, in partnership with Global Health Advocacy Incubator, decided to use parliamentarians is to ensure that policies that we develop address those gaps and to ensure that we have adequate resources, especially vaccine, for the future generations. We are also looking at sustainability. And we're talking about vaccine sovereignty. If our children die of preventable disease, we will not have anybody to govern in future. And so it's important to ensure that every child, every Ghanaian child, delivered or born in Ghana, should be protected using the vaccines that the government is supposed to be supporting.
The HFFG has for many years supported the EPI by raising awareness and community mobilization with queen mothers and opinion leaders on the need for consistent immunization.
We work with volunteers, we work with traditional leaders to ensure that the women with children under 5 send their babies for polio, and even in schools, we partner schools. And what we also ensure that our mothers are aware of is educated, and that when you give birth, even if not at the health facility at home. Immediately you give birth, send your child for the first polio, the 0 dose of polio, because that is the first contact. You know, our culture, if you give birth, a lot of visitors, they come. So immediately the child comes out, she should be protected. And in the hospital, automatically the child is protected by the health service providers. So at home also the same thing.
During vaccination campaigns, polio volunteers try as much as possible to move from house to house in search of children under 5 to administer the vaccines to children. They are never perturbed by the challenges on the field. Dr. Mohammed says the EPI will need more commitment from government, civil society, parents, and the public to be able to protect children as well as maintain the country's polio-free status.
We have vaccines that are effective in protecting the population against polio. And if the vaccines are available, then we'll only encourage our caregivers to make the children available for the vaccine. When these children are vaccinated, it will protect them, it will protect their future against all forms of disability that may arise from the polio disease. To get this done, it means that we all have to support, and that support will come from you and I. My role is to ensure that I make vaccines available, but the role that we request from our viewers, caregivers, mothers, especially our fathers, because they drive the home, is that they support the family to make all the eligible children have a dose or the shot of their polio vaccines, both the oral and the injectable that we are giving now. The oral one, we are saying that at least you should have ensured your child received the 4 doses. And then the injectable, we are giving 2 doses now. The injectable or the inactivated polio vaccine, which is the injectable, we are giving at 14 weeks and then at 7 months now. All children that are 7 months and above are eligible. So let's present them, if they've already received the first dose, to be given their second dose, so that we'll be able to ensure that Ghana remains polio-free for now. And hopefully, in the not too distant future, we are able to all contribute to the global polio eradication effort.
Immunization is not just a medical act, it's a national responsibility. Parliament has formed an immunization caucus to secure domestic resources to keep the vaccines flowing, even as donor support like Gavi gradually ends.
A polio-free Ghana will mean a lot in the health sector, and then 2, it will mean a lot in the community. As a country, we have a lot of polio cases. It means that your health system is going to be overwhelmed, where the little resource that could have been used to support other areas of healthcare will have to be spent on taking care of these children. You remember when we started, we said that they become more or less like a burden to the society. Government will have to be opening schools, so there's school for the disabled, school for so and so, just because they are down with the condition. So if we are polio-free, and by extension we are able to contribute to global polio eradication, then so much resources is being actually put in to ensure that polio is eradicated. And so if we are able to contribute to it as a country, then that resource could now be channeled to other areas.
Despite challenges, Ghana has been doing well. In fact, if you look at our expanded immunization program, EPI, Ghana is one of the top performing countries because we have clinical leadership, very, very competent, and up to the task. And our coverage, this is as compared to other countries. I think averagely, if you take our coverage, it's around 80. Let me just say at least 80. Yeah. we may have plus minus, but average is, let's say, 80. There's a need for that sustained protection for the people in the population. So these vaccines, we don't have to break, except those that when you take it once, maybe with a booster, you don't need be immunizing it every year or every now and then. But the rest, as long as we continue to give birth to new children, they must be protected.
As a survivor myself, we see hearing the story from the horse's own mouth actually means a lot. Look at me. Growing up, I had passions. I wanted to at least be a sports person. Yeah, people can argue that there are disability sports here and there. That wasn't my plan. That wasn't my passion. I wanted the mainstream, to enter the mainstream sports. And look at me. I cannot follow my passions, maybe like join a Black Stars or something, you see. So I want to implore parents, so long as you're a parent, the love for your child is very, very deep. I don't think any parent would want to see his child grow to be holding sticks and walking. So I implore parents that polio vaccination is an important thing. It's very, very important that we should take seriously to at least give the preventive measures from children being affected by the polio maladies.
Bidole prevention, immunization, bidole prevention, anti-polio vaccine, yen somo frana no, polio, stop polio, polio dem doroti empebio, fight polio, end polio, polio dem doroti empebio, for the end polio, stop polio, polio dem doroti empebio, fight polio, end polio, polio dem doroti empebio. Sister kama, brother kama, bofra kama, polio ye won basa, yem pesa.